If you are diagnosed with a thyroid condition, you should listen carefully to this. If you are diagnosed with a thyroid condition and are given medication to take for the rest of your life, you should listen carefully to what I'm about to say. If you are diagnosed with a hyper or hypothyroid condition and you do not want to take medication for the rest of your life, you should stop this video and take a pen and a piece of paper to take notes. You're about to hear some groundbreaking, transformational knowledge which has helped hundreds of chronic thyroid patients successfully nationwide. I have studied over 10 years of latest research in diagnosis and treatment of hyper and hypothyroid. I'm also trained by the country's leading expert, Dr. Michael Johnson, with functional endocrinology, functional neurology, and functional medicine. Imagine being able to sleep well, having the energy to go throughout the day, being able to enjoy life to the fullest with your children, family, and friends. Not being able to sleep could cause a lot of problems. Not being labeled that you have a thyroid problem and having to take pills for the rest of your life. My name is Dr. Maz. I practice at MedWell LLC in Midland Park, New Jersey. We are a panel of doctors and therapists working together at one location. I'm also the author of this book, How to Live Pain-Free and Happy, Drug-Free, Non-Invasive, Non-Chemical, Non-Surgical Steps for Resolving Chronic Conditions like Thyroid. What makes us different is we treat and diagnose thyroid metabolically and neurologically. And the big question is why? Because we do not label you with hypothyroid or hyperthyroid and give you medication for the rest of your life. There is a reason that your thyroid is not functioning properly, and most of the time the reason is not the thyroid gland. There is a good chance that your doctor is treating the symptoms and not treating the cause of the problem to fix you. Why I say that? It's because most hypothyroid patients are prescribed medications for their entire life. In this office, our goal is to fix you and not only your symptoms. You have these symptoms because you're a sick person. Your sick body is making your symptoms. And it's not the other way around. Your symptoms do not make your body sick. Your sick body is making your symptoms. This is an eye-opening class. We do life-changing care in 6 months. I do not want to be abrasive. Please don't get me wrong. Most people like to be nice than effective. I want to change your life and I want to be effective. My goal is to add value to your life so you're able to do what you want to do, able to spend quality time with your children, family, and friends. I want you to ask a question from yourself. If I continue doing what I have been doing or I'm currently doing, will I be better, same, or worse in a year from now? Most likely the answer is I will be worse. If your current treatment would be treatment to fix your body, you would have been fixed by now. The reason no one has fixed you is because no one wants to fix your body. They want to manage or fix your symptoms. That is a problem.
When I first arrived, I was having lots of pain, taking a lot of medications, and more than I wanted to, and was uncomfortable on a daily basis. Since being here, the relief has improved, the medication has diminished, and I feel great now.
The purpose of this video is to inform you with what is available to selected certified doctors and enable you to be able to enjoy life with your family and friends once again. What if I tell you you have been misdiagnosed? That means the reason that you have this problem, it has not been addressed. So the cause of your thyroid problem has not been addressed. And that is why your thyroid is not working properly, even with medication. Because when you get off the medication, it's not going to work properly. What if I tell you information that pharmaceutical companies don't want you to know? Because they sell thyroid medication. Most common, Synthroid. What if I tell you pharmaceutical companies are the ones who do the research and inform your doctors what to give patients and what not to give patients? What works and what doesn't work? Usually pharmaceutical companies, actually not usually, all the time, pharmaceutical companies do not patent supplements. Why? Because number one, in my opinion, because everything I say is my opinion, is there is not enough money for them. Number two, pharmaceutical companies cannot patent natural stuff that has been working well in China for the past 5,000 years. If your symptoms wax and wane, you better listen to what I'm about to say. If all of your lab tests that you went to your doctor and all of the lab tests, they were normal, and you still have the symptoms, you better listen to what I'm about to say. If you take a list of medications or supplements and you still feel horrible, you better listen to this video. So I want you to listen carefully. You can grab a pen and a piece of paper as you wish to take notes, because I'm going to go over a lot of stuff about thyroid condition. Let's go over thyroid. Every cell in your body has thyroid receptor. Every cell in your body has thyroid receptor. When you have a thyroid problem, every function in your body gets affected or slows down, including your brain function, your gut function, your hormones. You may get constipated, you may have muscle problem, you may have hair loss, many things. When you have hypothyroid, that means the body lacks sufficient thyroid hormone. When you have hyperthyroid, the body has overproduction of thyroid. Well, there are reasons behind that. Most often, patients have a condition that is causing their thyroid symptoms. Hashimoto's thyroiditis. This is a condition in which the body's immune system is attacking your thyroid gland. This is an autoimmune disorder. It is diagnosed by checking your thyroid antibodies, which are not usually checked, TPOs and TGBs. It's also checked by gluten antibodies. There are antibodies and gluten sensitivity in most cases that are often, they need to be tested, but they're not tested. At least they're not tested properly. We need to find out if you have an autoimmune condition. In other words, we need to find out what in your body is not working properly, which is causing your immune system to attack your thyroid gland and causes thyroid dysfunction. The solution is not medication and make the thyroid dysfunction to disappear. The solution is to find the cause. Because your immune system is attacking your thyroid and your doctor keeps giving you medication, it will not solve the problem. It will not work to fix the problem. We may be able to treat your thyroid condition naturally without medication, but I do not, repeat, I do not want you to get me wrong. I'm not here to tell you that medications don't work. I'm not here to tell you to stop or change your medication. I'm here to inform you about what is available, which has been working successfully on hundreds of patients nationwide.
Dr. Mahwah is one of the most caring, compassionate people that I've ever met. Not only is he one of the top of his profession and able to truly help people, but he really cares. If you need help, go see Dr. Mahwah.
I've come all the way from New York City, and it's well worth the trip. I feel very calm, and I've gotten a lot of benefit out of coming here. The progression of my disease has been slowed down considerably, and I feel that the staff is very much attuned to my needs.
90% of thyroid problems are autoimmune. Most of them have a hidden gut infection, including myself. I had a hidden gut infection that was causing hormonal imbalance in my body. You cannot drug yourself out of a metabolic disorder or an autoimmune condition. You cannot take enough drugs to get rid of your metabolic disorder. There is no drugs that will cure metabolic problem. There are 6 pathways to have a thyroid problem, and only one of them could be helped with medication. Unfortunately, there are a lot of doctors who only look at TSH and gives you medication based on the result of that. This could be dangerous because if you're not looking at the other stuff, there may be other problems. For example, you better hope that you don't get pregnant if you may have a Hashimoto's thyroiditis. Why? Because if you get pregnant and you have Hashimoto's thyroiditis, that could cause developmental disorders. That is how important it is to do the testings properly. The way thyroid gland works is that thyroid gland releases T3 and T4 hormones. T3, T4. T3 is active form, T4 is inactive form. You have about 7% T3, 93% T4. We need 4 T4s because there are a lot of them. We need 4 T4s to get 1 T3. If your doctor only checks at TSH, that's not enough. This is practicing 1960s medicine if we don't check for T3 and T4. We need to practice cutting edge medicine, not 1960s medicine. We need to check TBGs, thyroid binding globulins. They should be between 17 to 28. That's a protein that transfers T3 and T4 throughout different parts of the body for conversion. 60% of your T4s, which are inactive ones, they get converted to T3 in your liver. So we need to do a blood test specifically for liver to see how this conversion is happening. How many times your doctor has run that test on you? None, in most cases, at least from the patients that I've had. 20% of your T4s, they get converted to T3 in your intestine. So we have to do a gut testing, a proper gut testing, to see if that conversion is taking place. How many times your doctor says that your liver is not functioning properly because of your thyroid problem? None. Why? Because liver is a digestive organ, thyroid is a metabolic organ. One doctor studies one and not the other. One doctor gives you medication by looking at the organ. This doctor gives you medication by looking at this organ. We need to fix the whole body. There is a way to do that because you do not want to leave any stones unturned. If you cannot convert T4 to T3, your body cannot burn fat. No matter what you do, what exercise you do, what diet you go, you cannot burn fat if your body cannot convert T4 to T3. That is why we have had patients who went through this protocol who have lost over 60 pounds through this thyroid recovery program that I'm about to tell you.
It's amazing the difference today, that my feet feel good, I sleep well at night. It's just incredible the results that I'm getting from MedWell. And I know it will continue, and I tell you, I look forward to my treatments. And the people here are so professional and so competent that it's just a pleasure to be here.
So as I said, there are 6 pathways for hypothyroidism. First pathway is primary hypothyroid. That is the only pathway that could be helped with medication. This is the scenario that the actual thyroid is a problem and Synthroid works great. Second pathway is secondary hypothyroidism. That's due to pituitary gland malfunction. Taking Synthroid is not going to fix it. What we need to do, we need to fix the underlying cause. The problem in this secondary hypothyroidism, which is the second pathway, is caffeine intake, high carb diet, infection, sugar problem, standard American diet, Big Mac, soda consumption. The worst thing to do is to take Synthroid. The third pathway is secondary hypothyroidism due to under-conversion of T4 to T3. That's under-conversion caused by too much cortisol production. Cortisol production gets managed by your adrenal glands. Adrenal glands, they're glands on top of your kidneys. What they do, they manage cortisol production. Now, cortisol should be at its highest in the middle of the day and its lowest in the middle of the night, because that's in charge of your sleep pattern. As a side note, if cortisol is low in the morning and high in the middle of the night, that could cause sleep problems. So no matter how many Tylenol PMs, how many Ambiens, how many sleep medications that you take, time released, not time released, whatever released, it's not going to fix the hormonal balance. It's going to mask your symptoms. And as soon as you get off it, you cannot sleep because you get used to it, which is not the topic of this DVD now. The fourth pathway is secondary hypothyroidism due to overconversion. This happens commonly on the female patients who want to get pregnant and they cannot get pregnant. This could be the reason. No matter if you go to your infertility doctor, you do the shots, you still cannot get pregnant. This could be the reason. There are Hashimoto's. They have autoimmune condition. They have increased testosterone. They have polycystic ovarian syndrome. The fifth pathway is increased thyroid binding globulins. When you have increased thyroid binding globulins, the antibodies, you have too much of them, therefore we need to check your estrogen, we need to check your progesterone, we need to check your hormonal balance, we need to find out if you're suffering from an autoimmune condition. And the sixth pathway is thyroid resistant because of inflammation, because of homocysteine. All lab tests are normal in this case. Those are the patients that have been to doctors. They have done all the lab tests. They are normal. Well, most of the patients who come here, they haven't had all the lab tests. And if you have had all the lab tests, they're not done properly. Assuming if they are done properly, those are the patients who, with all the lab tests that are normal, they still have a thyroid problem. It's because of inflammation. Inflammation is the #1 cause of death in the United States. It's not cholesterol. It's inflammation. 5 out of the 6 ways that we mentioned above, they're autoimmune condition. This means you're chronically sick and causing your immune system to malfunction. As a result, it attacks your organs, which in your case was your thyroid condition, and it attacks your thyroid gland. As a result, you're diagnosed, or for lack of a better term, you're labeled as having thyroid, hypothyroid, hyperthyroid. You're given medication to balance your thyroid. Meanwhile, the thyroid gland is not even the case. Meanwhile, the thyroid gland is not even the cause of the problem. That is why when you start taking thyroid medication, you can never stop for the rest of your life. Actually, they tell you to take the medication at the same time every day. So I want you to know that a lot of thyroid sufferers, they have Hashimoto's, thyroiditis, and that is an autoimmune condition. Most chronic patients, most chronic conditions and autoimmune conditions, they have one or all of the following symptoms. One is oxygen dysfunction. We are all oxygen deprived. Lack of enough oxygen in the body. If you don't have enough oxygen in the body, your body will not function at its optimal level. Now, I want you to understand, some of my patients, they go to their primary care physician. Primary care physician tells them that they have enough oxygen in their body. Your doctor is checking your oxygen level based on your cardiovascular system. That is not the oxygen level we are talking about. We're talking about the oxygen level based on your neurological system, not your cardiovascular system. Neurologically, you need more oxygen to be at its optimal level. The second problem with chronic condition is neurological misfiring. I want you to understand, brain controls your entire body. If your brain does not physiologically work properly, it's going to cause problems. Many times thyroid problems, many times sugar problems, because it does not control physiologically properly. Third is metabolic imbalance. If you have bacteria, parasite, virus in your gut that is attacking your immune system will cause problems for an organ in your body. In many cases, which could be your case, is your thyroid gland. It could cause adrenal malfunction, as we discussed, interrupt sleep pattern. This could be the cause of your sleeping problem. You may have gluten, egg, milk, soy, or yeast sensitivity. Gluten is a toxin. If you have sensitivity to gluten, you better get off it, because by just doing that, you may get rid of your thyroid problem. Yes, you heard me correctly. By just getting off gluten, you may get rid of your thyroid problem, and you feel about 10 times more energetic. Imagine having introduced toxin to your body every day. Well, that's why you feel fatigued every day. What we need to do, we do not want to leave any stone left unturned.
I came here because I couldn't sleep at night, excruciating pain, kept me awake. It's been a couple of years. I'm on morphine patches. I got off of them now, and I'm sleeping through the night, and I feel so much better. Unbelievable. In 7 visits, I can't believe it.
What makes us different is we diagnose and treat thyroid problem metabolically and neurologically. Our goal is to investigate the true cause of your thyroid problem. We define what is the actual cause of your thyroid problem. We design a treatment and diagnosis to find that underlying cause and deliver the treatment that will hopefully get rid of your thyroid problem. Because the problem is not thyroid, the problem is the autoimmune condition. There are certain lab tests that needs to be done to assess the true cause of your thyroid condition that is caused due to your immune system attacking your thyroid gland. Our job is to find out what is that cause, because the treatment is going to follow that. And the cause of your thyroid problem is what is missed commonly among doctors. If you have an autoimmune condition, you will not get better by itself. And that could be the reason that you're not better. If your immune system is being attacked and it's attacking your thyroid gland, you cannot take enough drugs or medication to get rid of your immune condition. So here is how we're going to attack this problem. First, we have to diagnose the problem properly. First, we do blood testing. Comprehensive thyroid panel. That includes T3, T4, free T3, free T4, thyroid antibodies, metabolic panel, lipid panel, complete blood count, auto differentials. We test 55 different areas of your body's function. I guarantee you that you have not had all the tests that I will tell you that you need to have done. And if you have most of these tests done, they have not been done as elaborate. That's what we are going to do. With the blood test, I want you to understand something. Just having blood tests done, that doesn't mean it's done properly. Just because blood tests done, that doesn't mean every single aspect of the thyroid was checked. Okay? So, another thing is, There is lab ranges and there is functional ranges. If your number falls within the lab ranges assigned by the lab company, that doesn't mean you're normal, and if it's out of it, abnormal. Okay? What we're looking at functional ranges. Functional ranges that are a lot narrower than the lab ranges that are given by the lab companies. The next test that you need to have done is food sensitivity testing. If you have sensitivity to gluten, eggs, milk, soy, or yeast, you will not get better. And that may be the reason that you are not better. The only way to see if you are food sensitive, if you have sensitivity to gluten, casein, or have celiac gene, is to get tested. It's not that if you have gluten you feel sick, or if you have casein you get sick. The only way to know if you have gluten sensitivity, casein sensitivity, or have celiac gene is to get tested. Gluten could destroy your body, and every day you're having it, that may be the reason that you're sick. The next test is adrenal stress index test. We have to check your adrenal glands to see how they manage cortisol production, because cortisol is another toxin. Too much cortisol, it will change the color of your brain. It's a toxin in your body. In addition, we have to see the cortisol production throughout the day. That could be the reason that you cannot sleep and you're taking sleep medication. Or you're going crazy, why I can't sleep? I go to doctors, I still have problems, all my lab tests are normal, I still have a problem with sleeping. We may have to do a hormonal panel. We may have to check testosterone, progesterone, growth hormone. Hormone levels are extremely important in controlling your thyroid condition. You may have a H. pylori. You may have a leaky gut syndrome. You may have a bacterial or viral or parasitic infection in your gut that is attacking your nervous system, and that is why you're not better, because that was my case. I had a parasitic infection in my gut and it was affecting my whole entire life. I had lack of energy. In the morning I had no energy. Your gut does not have pain receptors. Your gut, if there's a problem, it inflames. It bloats up. You get indigestion. You get constipation. You get diarrhea. Okay? So just because you don't have pain, that doesn't mean everything is normal. Your brain, when it's inflamed, you get brain fog. You get to a location that you go every day, all of a sudden you're there, you don't know how you got there. That's called a brain fog. You call your children every day by their name, all of a sudden one day you call one child the other child's name. That's called a brain fog. You cannot think straight. You cannot do simple math. That's called a brain fog. That could be the reason, because of an autoimmune condition. Autoimmune condition could cause a lot of chronic problems for all of us. People are so sick that they think there is such a thing as a normal headache, normal migraine, normal lack of sleep, normal constipation. That bothers me because none of these is normal. So, as far as neurologic aspect of evaluation, neurologically we need to examine your brain and your brain firing to make sure your brain is working at its optimal level. So we examine and test you to see how well your brain works physiologically. Those are the tests that you stand up with eyes open, eyes closed, finger to nose, finger to finger. We're going to check your gait, your balance, to see how well your brain functions. We have to check your eye movements to see how well your brain functions, because your brain controls all of your body. Are you ready to open the combination of your life? You guys are all here because you choose to be here to get rid of your symptoms, pain. By doing what I'm going to go ahead and tell you to do, I'm going to enable you to get your life back. So you don't have to suffer with pain, numbness, neuropathy, tingling. you won't be able to experience chronic fatigue, tiredness. That's why we're all here. We're going to define, design, and develop a treatment plan that's going to be effective and enable to get your life back. So one more time, you can get up in the morning and you had a restful sleep and you haven't lost your mind. Now, we're going to talk about how do we treat this autoimmune condition. Once again, as we talked about before, we diagnose thyroid problem metabolically and neurologically. And that's why we have to run all those testings. As far as the treatment, we are going to treat it metabolically and neurologically based on the results of the test that we did. The treatment protocol that you will hear has helped hundreds of thyroid patient sufferers during the past decade successfully. First is the neurological. If your brain works at its optimal level, your symptoms will dissipate. Now, your brain needs two things to survive. Your brain needs two things to work great: fuel and activation. Proper amount of energy and proper amount of signals to work properly. The fuel part, the energy part, the brain gets its energy from glucose and oxygen. Glucose is handled metabolically with what you eat. But oxygen is extremely important because brain does not store oxygen. Your muscles do. Your brain does not. And the problem with that is, as you age, your ability to utilize oxygen diminishes about 1% a year after the age of 25. So that means if you're 50 years old now, your ability to utilize oxygen has diminished 25% already, and next year will be 26%. So we all may be oxygen deprived. You may go to your primary care physician, as I explained to you. He or she may say that you are not oxygen deprived. I want you to understand, they are talking about oxygen deprivation based on your cardiovascular system and not your neurological system. Your neurological system needs more oxygen. So, how do we give more oxygen to your body so your brain can have more oxygen? We give you supervised oxygen treatment on site prescribed by our doctors. In addition, for neurological aspect of your thyroid condition, we may give you visual stimulation, olfactory stimulation, and auditory stimulation to make sure your brain physiologically work at its optimal level so it can control your functions of your body. Metabolically, the first and foremost important supplement that we need to introduce your body to is glutathione treatment. Glutathione is a natural antioxidant. Antioxidants, they get rid of free radicals. If there is not enough antioxidants, you have a lot of free radicals. No good. Antioxidant, some patients, they call it anti-cancer medication. They are really good to keep you young and make your body fight with conditions. And most of us, we do not have enough antioxidant in their body. So what we need to do, we need to give glutathione treatment. Glutathione is a mother load of antioxidant. It is the strongest antioxidant that I know of that is available. And I personally, at this office, have had great results by giving glutathione treatment to my patients.
I have to say that at this time, I could sleep all night, through the night, without pain meds. I don't use the cane. I just can't believe the difference between my condition when I came in and today.
Glutathione is the #1 antioxidant for the body. What kills it? Tylenol, acetaminophen. It kills glutathione, it kills the stomach lining. There are specific supplements based on your needs and results of the test that we need to give you to attack your thyroid problem. You may need hormone treatment. You may need progesterone treatment, testosterone treatment. So based on the results of the testings, we need to come up with the solution with the metabolic and neurological treatment that we give in this office. At this time, I want you to ask this from yourself. How is your thyroid condition is affecting you with your job, finances, relationship, family, and other activities? What is it costing you in terms of time, money, happiness, not being able to sleep? Where do you picture yourself in a year from now? In 3 years from now? In 5 years from now? If you don't take care of this problem? What is it costing you not to be able to do what you want to do with your family and children? What is it costing you not to be able to sleep? If you're serious about correcting it, you need to contact our office. If you don't care about your health, do not contact our office. I do not want to waste your time or waste our time. I do not need to do this anymore. I do this because my passion is to help people to live better and add value to your life. You can get treatment or not get treatment. It's not going to make a difference in my life. Your health is not your employer's responsibility. Your health is not your government's responsibility. It's not even your insurance responsibility. Your health, it is your responsibility. Sometimes people who are skeptical about care, they ask me, Dr. Maz, can I go talk to my doctor about this? And my response to them is that if your doctor knew about what I'm telling you, you would have been fixed by now without taking any more pills. Your doctor is treating your symptoms and not fixing you. I'm not talking about all doctors, I'm talking about generally. I want you to go to a doctor who understands those 6 pathways. I want you to go to a doctor who understands an autoimmune condition, how to diagnose it metabolically, how to diagnose it neurologically, and how to treat it metabolically and neurologically. There are only a handful of selected doctors in the northeast of the United States who are trained with functional endocrinology, functional neurology, functional medicine, and have reviewed the latest 10 years of research about that. I'm asking you permission to help you. If you're serious about getting your symptoms corrected and handled, our office is for you. Call 201-848-8000. Not everyone is accepted for care. We only accept patients who we feel we can help. So if what we have said to you has made sense to you, then you need to call our office and make an appointment with one of our new patient coordinators. When you come to our office for a consultation, you may get tested and start treatment the same visit or the following visit based on how busy we are and what we need to do in your specific scenario. Unless you're coming out of state, as a courtesy, we start you with the treatment and testing the same visit. Can we guarantee the results? No, absolutely not. Are we successful? Yes, very successful. This is Dr. Maz saying thank you for watching this video, and I will look forward to seeing you in the future. You can call us at 201-848-8000. And yes, we accept most insurance plans. And God bless you and your whole family.